Home preparation for a total hip replacement is an important aspect of the rehab process before surgery here. And I want to go through a couple things to really look out for when one is preparing their home life for this particular surgery. But before I begin, my name is Eric Hammer, owner of Home Comfort Physiotherapy, and my purpose and passion is helping older adults to regain their function in their lives. So again, today I want to talk a bit about this sort of home preparation that's going to be, again, important uh, prior to your surgery here. So the first thing I want to talk about is the idea about there's certain limitations that a patient will have after they've got this total hip replacement if they're getting a lateral surgery done, basically a cut along the side here. One of those precautions or restrictions is going to be an inability to raise that hip beyond 90 degrees, right? So what's going to be really important for that then is to have a raised toilet seat, right? So this is going to be one thing, again, you're going to want to prepare for prior to your surgery is a raised toilet seat. And also I would suggest just having a regular seat where your knee isn't going to be, your knees aren't going to be higher than your hip. So again, certain seats might not allow for that, like certain couches, for example. So you're really going to want to prepare yourself to be able to know, what seat you're going to be regularly in. Going back to that idea about the hip flexion precautions, it's going to be really important as well for reaching items to have some kind of a grabber, so to speak, because again, you're not going to be able to bend past 90. So it's going to be really important to have some kind of a grabber that you're going to be able to reach for things on the ground so that you don't go past that 90-degree mark. Next thing to keep in mind would be footwear. So again, because we're not going to be able to go past this angle here, having some shoes that you can kind of slip on, or having one of those really shoe horns that are very long to be able to use so that, again, you don't go past that position is going to be really important. Other considerations too are going to be for sleeping, bed position. So making sure that, because one of the restrictions perhaps might be crossing one leg over the other. And so you're going to want to have something that you might be able to put between the legs in order to prevent this from taking place. So again, another preparation for yourself. The other thing to keep in mind too is that stairs more than likely are going to be very challenging to do after the surgery. And so you're going to perhaps want to set up your household in a way where you're going to be able to easily get to your bed and being aware of, do I have stairs or not? Now, typically what they'll teach in the hospital too is that prior to leaving the hospital, if you do have stairs, the typical rule of thumb is to go up with your non-surgical and down with your surgical. So that way you're not putting as much weight on that surgical site initially. So again, these are just some things to consider in terms of your own household setup, as well as if you're able to change rooms or make an adjustment in that way in order to perhaps, at least initially, not need to use the stairs quite as much. Other considerations is you're going to need to use a walker immediately after your surgery. And so just being cautious around changes from, let's say, floor to carpeting, or if there's sort of a lip between rooms or near the or on the doorway. So just being cautious around the fact that, hey, I'm going to have to move around with a walker here, and any obstacles that might be in your way in terms of impeding your ability, right, to use the walker and to walk in a comfortable fashion. If you have any questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure this and any other information is appropriate for you. And if you're an adult who might be struggling with their post-surgery, let's say, or struggling with some discomfort, some pain, something that's limiting your functioning, perhaps you've just had a total hip replacement or a total knee replacement, and you're needing some guidance, whether it's with your exercises or the ergonomics involved in that, or just in terms of setting up the house in a way that's going to best work for you, feel free to reach out. I do have my website link below. Thanks again for watching, and have a great day. Take care.